Depersonalization disorder often gets confused with derealization disorder, yet while the two are similar, there are key differences. Ahead, learn what those differences are, including more about the symptoms of depersonalization, what causes it, and how to treat it. Depersonalization disorder can cause significant distress and impairment because a person is living in an altered perception of their own life. However, it isn't a psychotic illness or delusion because they are aware of these disconnected feelings. Patients often describe it to me as an incredibly scary and uncomfortable experience, says Dr. Palmer. There can be many causes of depersonalization disorder. Dr. Hafiz says a traumatic event or prolonged stress, such as a sudden death or witnessing or experiencing extreme violence, can often trigger the disorder. It's also frequently associated with other mental health disorders, such as depression, anxiety, PTSD, or schizophrenia. Drive. Palmer adds that depersonalization disorder can also be caused by physical changes or disruptions in your body, like neurological illnesses such as epilepsy or complicated migraines, drug or alcohol withdrawal, or side effects from certain sedative medications. The main symptoms include, but are not limited to, feeling robotic and not in control of your movements or speech, inability to describe or recognize emotions, and feeling disconnected to your mind, sensations, or body. Dr. Hafiz, both derealization and depersonalization involve feelings of disconnect, but depersonalization is how you view yourself, while derealization involves how you view the outside world. So in essence, the former condition, depersonalization, directs the unreal perception towards the inner self, whereas the other involves projecting this feeling on the environment, says Dr. Palmer. Derealization is when you feel as if you're observing the world through a veil and feel detached from your environment and the people and objects in it, adds Dr. Hafiz. Symptoms include feelings of being in a dream, like you're living in an unreal or artificial world, distorted perceptions of sound, and feelings of time passing too fast or too slow. Psychotherapy can help individuals learn techniques or coping mechanisms that distract them from their symptoms and make them feel more connected to their feelings and the world around them, says Dr. Hafiz. Drive. Palmer says reducing stress levels can also play a vital role in treating depersonalization disorder. Use of stress reduction techniques like relaxation skills, mindfulness, and distraction can be quite effective, she notes. Maintenance of a well-structured routine with adequate nutrition, hydration, sleep, and exercise may also help in reducing symptoms. If you're having an episode of depersonalization, distracting yourself by throwing cold water on your face, doing sudden quick movements like jumping jacks, or engaging in deep breathing can help bring your awareness back to reality, says Dr. Palmer. And in addition to psychotherapy, both experts say prescribed medications, like antidepressants or anti-anxiety drugs, can be helpful. Ultimately, don't be afraid to seek help from a professional to help you get your life back on track.